Crossfire 99.3 Nigeria Info. Welcome to the show. If you're just joining us, well, you're in time for the final lap, and this is where we have a full house talking about a very important issue today. Like we told you all morning, we're looking at Ebola management today, and it's a full conversation. A while ago, the NCA gave a warning about Ebola. The Nigeria Civil Aviation Authority on Tuesday, 13th, that was last week, issued a warning to all airlines operating regional and international flights over the resurgence of the deadly Ebola virus. And with this, the WHO on its website as of 8th of August reported that, I quote, "The Democratic Republic of Congo is grappling with the world's second largest Ebola epidemic on record, with more than 1,800 lives lost and 2,600 confirmed infections since the outbreak was declared on the 1st of August 2018. With the number of deaths occurred, the outbreak is the second largest on record after more than 11,000 people were killed in Guinea, Sierra Leone, and Liberia between 2014 and 2016. We're looking at all this all-important conversation of the Morning Crossfire for the next 1 hour. Welcome to the show. I'm Wemimo Adewuni.
And I'm Sheriff Quadry. Remember, you can join us on YouTube and Facebook. We're streaming live on those platforms. You can see our guests in the studio as well. Our address on YouTube is at Nigeria Info FM. And on Facebook, we are Nigeria Info FM as well. So feel free to join the conversation. Drop your comments on those portals as well. We'll take your comments as we go along on the show this morning. And don't forget as well, our WhatsApp portal is also on. So you can send us your questions on our WhatsApp line 0809 597 5805. That is 0809 597 5805.
All right. So remember to leave us your comments on those portals. And we have in the studio with us Rotimi Sankore. Rotimi, good morning again. Okay, we have Miss Chinyere Ugo here with us in the studio. She's a senior medical laboratory and scientist at a general hospital here in Lagos. Good to have you here on the show.
Good morning.
All right. And on the line, we have a full house today. We have joining us Chikwe Ihekwazu, who's the Director General, Nigeria Center for Disease Control. Good morning, sir. Thanks for joining us. Hello, can you hear us? Okay.
Hello, sir.
Maybe not.
Yeah,
hello.
Can you hear us? Good morning.
Yeah, this is Sam Adrobu on the line.
Oh, Mr. Sam. Good morning. Good to have you.
Good to have you.
Good morning. Good morning.
Okay, let's kickstart the show, shall we, by looking at this conversation. We told you that we were talking about Ebola, and it was a pretty big deal. When you talk about the name Adadevor, you talk about the name Patrick Sawyer, you think Ebola. But we probably aren't paying enough attention like we should to Ebola with recent information that we've gotten. On March 24, the WHO reported the outbreak of Ebola in West Africa. The first case was confirmed in Lagos, Nigeria on the 23rd of July 2014 and spread to involve 19 laboratory confirmed cases. These cases were not limited to Lagos, as Rivers State recorded 2 confirmed cases. One of the 2 persons died. 8 of the confirmed cases of EVD in Nigeria eventually died, and 12 were nursed back to good health. Now, let's look at Ebola in Nigeria. Let me start with you, madam. Ebola, how devastating is it? Let's talk about, I know Nigerians were scared, when we had the first Ebola outbreak in Nigeria. Everyone was worried about sweat, about washing their hands. But viruses evolve. What has changed with Ebola?
Ebola is still the same deadly viral disease that still causes hemorrhagic fever that affects the whole body. So Ebola goes through the blood, the body fluids. It has to do with the sweat. It's a viral infection, and all those places are involved. So you have to observe precautions, hygienes to avoid that. In fact, the best way to prevent that Ebola is traveling to those places where they have discovered.
Let's talk about what hemorrhagic fever is all about. Can you break it down for our listener? What is hemorrhagic fever?
Hemorrhagic fever, Ebola comes with all the symptoms like headache, muscle ache, sore throat, high fever, and all that. And then when it gets worse. It gets to the organs. It destroys the immune system. And then there's internal bleeding. People start coughing out blood. That's what we mean by hemorrhagic. When you mean hemorrhagic, that means there's blood.
Blood is involved.
Blood is involved. People start coughing out blood. Blood comes out of the ears, comes out of the eyes, and that's like the end cases.
Mr. Sam, you're the general manager and PRO of the Nigeria Civil Aviation Authority, and the NCAA gave out a warning last Tuesday. You issued a warning to all airlines operating at regional and international flights to exercise a high level of vigilance. What led to this warning? What have we found out? Is Ebola coming our way again in Nigeria?
Yeah, actually what happened is just to take a precautionary measures. And it's an aftermath of a warning that emanated from the World Health Organization. And this warning was given to every member state. And since Nigerian Civil Aviation Authority is the oversight body in Nigeria that oversight the flight operations, so we are the only body that can actually enforce the compliance to that warning. So that was why we have to sensitize the operators, meaning the airlines now, those who are operating along those regions, international, the interregional flight operation in and out of Nigeria. So basically the idea is to sensitize them again, and also to sensitize the members of the public.
Right.
Because in event of having such suspicion or a passenger that may have that kind of symptoms, then it will amount to delay of that flight, because they're going to go through everybody, check them all over, and make sure we won't have a kind of coming in to allow Nigeria to be infected. So flight may be delayed.
Mr. Adewuni, let me ask you this. When a passenger comes into the airport, he doesn't just get on the plane. He goes inside the airport first. What are the measures being put in place by the airport authority to make sure that passengers are protected?
Yeah, basically the system has been put in place ever since the first time this thing we have it on our hand. That was 2014.
Right.
The system we have is that you have the ported officials in conjunction, which is an arm of Federal Ministry of Health. Then, of course, Lagos State also join in it. And they have a process at the airport where people are screened. Majorly, the target then was those who are coming in. You want to believe that those who are going out already, they are healthy. You want to believe that they have
why do we believe so, Mr. Sam? Nigeria has about 1,500 unmanned borders. These people could have come in from the land borders and are flying on air. So
if you are going to go out on international flight, you are expected to have checked yourself, have your yellow vaccination card. That is an indication that you are taking vaccination against any communicable diseases,
including Ebola.
Of course, if you take vaccination, if you are going out of Nigeria, you take Nigeria is not an infected area. We don't have it here.
Right.
So
my point, Mr. Sam, is to say that travelers would get vaccination for the things, for yellow fever, for instance, amongst other things. But Ebola, we don't have vaccination for Ebola right now. And we don't know that people in Nigeria don't have Ebola. We only can make a calculated guess that we don't have Ebola right now because many of our borders are manned. So why do we assume that people going out of Nigeria don't need to be screened, only those who are coming into Nigeria?
Let me explain to you. We'll have a clearer picture.
All right, sir.
If a passenger is going out of Nigeria, you will remember that you have a vaccination card with you. You are expected to have taken all the necessary vaccinations. Now, but when they are coming back into the country, and that is where the attention is now. If you are coming in from those countries, of course, your passport will indicate wherever you are traveled to. The kind of passport we are using, MTDR, is such that once it's slotted into the machine on arrival by the immigration officer, they will see wherever you have touched. So that is where the screening is more. The focus is on that. Those who are coming in.
Mr. Sam, I'm going to say, I'm not sure you understand my question to you. Let me say this again. So for those coming into Nigeria, I'm coming back to that. But you mentioned clearly that we don't pay attention to those moving through our airports out of Nigeria. They would have contact with hundreds of people in the airport, and we have about 1,500 unmanned land borders. So there's a possibility that these people came in through the unmanned borders and are trying to fly out of Nigeria, and they would have contact with people at the airport. So why are we not focusing on outbound passengers?
Well, I don't know what I think the simple explanation I can give is that Nigeria is not an Ebola infested country. We don't have it here.
Right.
The attention is on the inbound passenger, those who are coming into Nigeria. It's not those who are going out. We don't have it. If we have it, of course, in a matter of days, you will have established that there is an Ebola infested patient here. So for now, we went through the whole process. Nigerians, people who brought in were quarantined, and this thing was, of course, we overcome it. So we don't have it here in Nigeria.
You sound very sure, Mr. Sam.
Of course, we are sure this thing was carried out, and we came out, we overcome it. We have a report of it that we don't have it. It was ascertained.
Just to be sure, Mr. Sam, just to be sure, before I let you go, what are those things that are at our airports to check those coming? You said we always have the measures there. What are those measures? Can you tell Nigerians?
The measure is we have the port official, health officials at the airport. Every inbound passengers are screened. They have a handheld machines which they apply on the passengers that are coming in. So
they still do that. Are you confirming that they still do that?
That is exactly what we have initiated all over again. That they should continue, and they have started already.
Okay, let's speak with. We have a Director General, Nigeria Center for Disease Control, Mr. Chikwe Ihekwazu on the line. Also, good morning, sir.
Hello. Sir.
Okay, we can't seem to hear him. We'll probably bring him back on the line. But Rotimi was shaking his head rather quite animatedly when Mr. Sam was speaking. I'm concerned about the
handheld thermometer. That is so inadequate. The handheld thermometer is so inadequate. What we need is a full body thermal scanner at every port of entry, so that as you are walking towards it, the scanner, it scans your whole body temperature from head to toe.
Right.
And everybody is looking at the screen. If the thing turns red, goes above a certain temperature, you are pointed in one direction immediately. This handheld thing is seriously inefficient.
Well, what do you think about this, Mrs. Madam here, Chinyere? What do you make of these handhelds? So you're a public health worker. How do you deal? So some of the symptoms of Ebola look like malaria. And malaria is pretty common.
Cholera.
Yes. So, and around here, if you're running, you have a fever, I mean, the first thing you're treated for is malaria. And many of these health officials have contacts with people all the time. So in your work, this handheld, which Rotimi doesn't seem to approve of, in dealing with Ebola, how effective is it?
It's not my opinion. That's the professional position.
Yeah.
If you go to other airports around Africa, it's the full body thermal scanner. You walk towards and through it, and it picks up your temperature
everything
from head to toe.
All right. What do you make of these handhelds in preventing another Ebola outbreak in Nigeria?
I think that's a rapid check which we use, but I think the main body scanner should be used. But then when people are going out of the country, not just when they are coming in, I think they should present their medical checkup. Like the Ebola virus has its incubation period of 2 to 21 days. 5 to 8 days is already getting. So people, you would have noticed, the person will be sweating, there will be high fever. So at least when the person comes in with a medical report and the person is being checked, there's issues that are, please, you can't travel. Please, you can't. We need to do further tests. We need to do further tests. And by the time you're waiting, and by the time the person is in the hospital or in the clinic, awaiting those tests, their cholera, their malaria symptoms, there are other tests that will be done, the liver function tests, the kidney function tests, the coagulation factors. Once they are all high or They are not normal.
What was the chuckle about?
She's been very ambitious.
Oh, you think we can't do all of those tests?
The facilities are not there. Look, the kind of investment we need to check this thing if it starts, the ministries of health at the federal and state level have not even started to contemplate it. The main test itself is always taken out of Nigeria.
Yeah.
I mean, just imagine that kind of embarrassment, not to mention the threats that it poses, that it sample has to go out before it comes back. Before then, you don't even know what is happening. Look, the overall, so there, in terms of epidemiology, there are several things that we need to do to prevent, contain, and we are not doing them. Look, even things like running water. You see, there is this thing that people do when they go to restaurants. You know, there is a bowl of water and you dip your hand inside it to wash your hand to eat. When you finish, they just shake the bowl and pour the water out.
Right.
And put out another water, and that person puts their hand. Look, the horror story that can happen in this country, because the public education, the literacy level, the awareness, all the things you need to do to ensure that if the thing enters Nigeria, we are so lucky. The last time we are so lucky,
and we are hoping that we'll be.
We are so lucky.
The next time.
We are not going to have that kind of luck again,
Mrs. Chinyere.
We won't. We are not going to have another Dr. Dedevo that can put herself and her clinic, identify the thing and say the thing is not going to leave
here.
This
We're going to stop it here.
Right.
You know, it's like people don't appreciate
Let's go to the phones. I'll come back to you. But we have joining us on the line now the Director General, Nigeria Center for Disease Control. If you can hear us, Chikwe Ihekwezu. Good to have you on the line, sir.
Hello, sir. Can you hear us?
Okay, so I think there's something with that line or with his line. We can't seem to hear him. But if you can't hear us, we can't hear you here. We'll try to connect again because it's important to speak with them also. But Mr. Chinyere had something to say about the health control while Rotimi was speaking.
Yes, he said it has to be taken outside the country. No, now. We have a virology research lab in Luth, in Idiaraba, where we use ELISA, that's the enzyme-linked immunosorbent assay, where this Ebola virus can be confirmed.
Right.
So you don't have to take it out. We have a virology lab which is linked to FHI, WHO.
When did we acquire this?
You know, during those periods,
right,
Nigerian government has to call for help.
Okay.
The USA, the WHO, they came to our, and this virology research lab was instituted where you have the scientists and main people who work on this who use ELISA, not just the rapid test or just the thermometer check.
How many of these
there's no lights in Luther.
Hold on.
Hold on.
How is it going to work without lights?
1 minute.
Hold on.
How many of these centers do we have? Do we have just one in Lagos? And is this one the only one we have in Nigeria?
Well, that's the most established one now in Luth. That's the one. That's the virology research lab. So we have our challenges about lights, but you know, that can
challenges. That's a disaster. Look, ordinary people want to do tests in Luth. They fill one form, give them and just point them.
Rotimi, let's
just point them to one lab somewhere. Ebola.
Let's
in that kind of situation.
DG of NCDC here, Mr. Chikwe. Mr. Chikwe, good morning to you. Can you hear us?
I can hear you. Can you hear me?
Fantastic. Finally,
how are you?
We've been trying to get through to you.
Good morning, Mr. Chukwe.
Okay, everyone is saying their hellos. Are you still there?
Yes, I am.
All right, fantastic. Now, we've talked about Ebola. We were lucky to escape by the whiskers the last time.
Right.
Unfortunately, it seems Mr. Sam's line has dropped. I'm hoping he can come back because I still have a lot of questions for him.
Right.
But the airports are not the only places to watch out for. We have so many unmanned borders, and this virus is close to home. Now, how prepared is Nigeria, in your assessment, for another outbreak? We don't want another one, but we can't wish it away. Are we prepared in case something happens right now?
So thank you and good morning, Lagos. I think the most important difference from 5 years ago when we had that Ebola outbreak is the existence of the Nigeria Center for Disease Control.
So 5 years ago, we were a rudimentary agency with a few people without a legal mandate and really without the expertise to deal with this disease. Yes, we managed to rally the troops and use resources around us and control that outbreak. And thanks to the heroic efforts of Dr. Stella Adedebo, who coincidentally this week marks exactly 5 years since her passing.
Right.
So may her soul continue to rest in peace.
Amen.
But, we have a competent agency now. So, I would disagree a little bit with my brother Rotimi in the studio, who says we have to send samples abroad. That's absolutely false.
Yeah, Mrs. Chiere here corrected that. Mm.
Yeah, in Nigeria, to make that diagnosis within 24 hours from a sample collected from anywhere.
If there is light. That's the point Rotimi was
light
making.
Light or no light. As long as you can collect the sample, our lab runs 24/7 in Abuja, weekends, daytime, nighttime. We have a team of first responders. We call them the N First. We can activate them within 8 hours of any incident in Nigeria. So in summary, my answer is yes, we are not where we want to be. But absolutely, we've moved light years ahead of where we were 5 years ago.
I agree there has been progress.
Yeah.
And I hope that Chikwe agrees to that we are not where we ought to be.
Yeah.
Oh, absolutely, like every other sector in our country. But I do think we must give credit where credit has happened.
Oh, Chikwe, look, if you know the wonderful things I say about you,
it's not about me, Roger.
Yes,
can we talk about the personal things? We need to go on a break now.
Because since Chikwe was appointed and the center, center was set up, because I know Chikwe, he's a great guy, he's very efficient, he's working against the tide. I know that Chikwe will not come out to strongly criticize the system too much out of diplomacy. We want Chikwe to have more resources. We know he's underfunded, and that's why we are doing the advocacy on his behalf.
Mr. Chikwe, is NCDC underfunded? Plus, add to that quickly, there was a report put out in June by the NCDC. I will quote it. Says the preliminary risk assessment has been conducted, and based on available data, the overall risk of importation of the Ebola virus disease to Nigeria remains low. What was this data based on, and is this assessment still the same? We don't have a high risk of having Ebola in Nigeria, is it so?
So let me take the first question about resources. We are definitely, we're all looking for more resources, but I would never want to be in Mr. President's shoes. The challenges in our country are huge. Every sector is requesting for more resources, but the reason why investing in preparedness is so critical is that, everything we can achieve in a number of years can be destroyed by one incredible event. Imagine if that Ebola event 5 years ago had gone the other way, international flights, stopped, economic activity stopped. So we have to invest. It's kind of an insurance policy in preparedness. Now, having said that, in terms of our risk assessment, this is a routine process we do for every disease. Actually, it's just that because of the profile of Ebola, we decided to release some of those results. We look at, firstly, the threat, and secondly, our response capacity. So we looked at the threats, where the flights come from, the absence of any direct flight to the DRC from Nigeria, and all the other factors around it, and came to the conclusion that the risk was low at the time. Now, that doesn't mean that we stop preparing. This risk assessment happens all the time, and it's not just NCDC, it's with multiple partners, and NCAA, the Port Health Services, the security services. We sit together frequently to do this risk assessment, and every time there's a series of actions that happen. But overall, the risk to Nigeria, compared, for instance, to 2014, remains low because of all the environmental factors and lack of direct flights and all of that between both countries.
All right. Mr. Sam is joining us on the phone, but we need to go on a very quick break now. When we come back, we're still looking at Ebola management in Nigeria. Are we ready in case there's another outbreak? What's the risk assessment? Mr. Chikwe Ihekwezu of the NCDC, that's the Nigeria Center for Disease Control, has told us that the risk of importing
It's
Ebola
quite
to
low.
Nigeria is quite low, very low right now. But what can we do? Especially because the NCA raised a red flag to airlines. So we're looking at all the options. We also have on the line Mr. Sam Adirogboye, the General Manager and PRO of Nigeria's Civil Aviation Authority.
Right.
Mrs. Chinyere Ugo is here with us. She's a senior medical laboratory scientist at the government hospital here in Lagos. Rotimi Sankore is here. And after the break, we'll also be joined by Dr. Jide Idris, the immediate past Commissioner for Health in Lagos. So tell us how it all played out then. We'll be back shortly after the break. We're live on Facebook, on YouTube. You can also reach us on Twitter. I'm Wemimo Adewuni.
And I'm Sheriff Quadry.
So thank you, guys.
More talk, news, and sports after this.
Immediate past Commissioner for Health in Lagos State. Good morning, sir. Thanks for joining us. Hello, sir. Okay, there we go again. We'll try again with that line to bring him back on to join us. So, Mr. Sam, let's go back to the airport.
Right.
Especially because the last Ebola incident came in, was important through the airport. So
and spread through the airport.
yes, I guess we're focusing now on the airport. Oh, it came in through this way. Let's just keep watching out for this same place. Are you working together, with the Nigeria Immigration Service? We had the DG or PRO here with us some time ago talking about the borders in Nigeria and so many of them unmanned, like I mentioned earlier. So we're looking at the port, but is that synergy with other agencies at the port to, screen and truly find out if we have this case coming into the country? The NSD tells us that the risk is very low, but we cannot be too careful.
Yeah, I can say categorically that we are working together at the airport. I can only speak about the airport. I don't know about the land borders.
Right.
But when it comes to the airport, we have what we call the security council meeting, whereby all the agencies are represented at the highest level. And it's regularly presided over by the Director General of Nigeria Civil Aviation Authority. So everything we are doing is coordinated. Apart from that, we often carry out what we call a random risk assessment. This is done medically, led by our own aeromedical heads, in conjunction with the port head officials, the Lagos State head officials, and all the relevant agencies. So randomly, we do carry out this check, even before now. Now that we got that red flag originally from the World Health Organization, that's why we have to issue that alert to the airlines and, of course, the traveling public, so that in event there has to be delays or cancellation of flight, then people will have to be in the knowledge of what is going on. That is exactly what we have done.
Yeah, indeed.
Rotimi, the National Health Act was signed into law in 2014. In fact, we have a new national health policy, which was approved February 2017. The policy is aimed at promoting the health of Nigerians to accelerate socio-economic development in the country. And this is the third health policy in the history of Nigeria. So 2 years after this, the National Health Act, for instance, stated that all Nigerians are entitled to basic minimum package of healthcare services. But now we're not sure if these provisions made in the NHA are capable of achieving universal health coverage. So right now, because Lagos is my biggest worry. Well, I live in Lagos, but the crowd in Lagos, the crowd worries me. If there is an outbreak in Lagos especially, it's a disaster.
Okay, so there are multiple issues to consider. First of all, the funding of that act is nowhere near where it ought to be. The funding is probably 20 or 30% of what it ought to be. And by any marking scheme, that's a fail. Two, we've discussed over and over on this station, we don't have the human resources that we need currently to cope with an epidemic at the scale they have in DRC. And that means that the public education has to be much higher than it is now, because you need to prevent. And that's why I was saying that if you go to a restaurant to eat and you say you want to wash your hand, they will bring you a bowl that somebody has just used, and they just throw the water out and you put your hand inside, you wash your hand and you start eating. Anytime I see that kind of scenario, honestly, I just get a blistering headache, because it means that the public health awareness that we should be doing, we are not doing. I can understand that it's partly because there isn't enough running water in the country, but there are some basic things that you can avoid. There are some you may not be able to avoid due to general poverty, like parking people inside buses, and you know they are squeezed,
rubbing off
they are squeezed so close to each other,
breathing into one another.
If there is an epidemic, we have to address it. In the meantime, the lack of investment in transport, we cannot help. But literacy and public health education, we cannot sidestep at all. Now, the reason why the last West Africa Ebola epidemic ended last in Guinea is because at the time, Guinea has the lowest literacy in the world. And in some villages where people turned up in their hazmat suits, their hazardous material suits, the villagers clubbed them and threw them into the ditches because they didn't understand
know what was going on.
So and you can see that kind of scenario happening in some parts of Nigeria if the virus goes outside cities. We are just really, really lucky that it was contained within cities. What we really need to do now is ratchet up the public education to such a level that we can be reasonably sure that there is almost nowhere you will go in Nigeria that people won't know what to do if they see certain symptoms. Now, we can't be sure of it. If you watch certain films, for instance, you will see that when your village people get to you, you start coughing blood.
In movies, right?
Yes.
Yeah.
And people don't understand that there is no correlation, between those kind of things.
Well, you think so. Some people still believe there is. But maybe our movies can begin to reflect our reality. Yeah,
obviously, the Nollywood people, we have a lot to do.
I know you have a response to this, but add to that also that there is a possibility that very soon specimens... let me move on to ask you about... dealing with Ebola. I know that there are some vaccines being worked on right now. It might be preventable sometime soon. Ebola might be preventable soon. That's exciting news for me. But what's that really about?
First, I want to mention mention on what you've said. Ebola is not spread through air or water.
Of course
or
not.
Food.
Of course not.
So it has to be a personal contact. As in, there should be personal contact with an infected animal, or someone goes to where someone that was infected
Bodily
was buried,
fluid.
or body fluid. So let's not say packing in the bus, maybe air or that. So
but parking in the bus, sweat could rub off. Right,
that-
if you are sitting too closely in a bus and
that's
the person
too
is
close.
sweating,
I think I agree with that, but I just wanted to say, he said water,
yeah, washing of hands.
You
Okay.
can't, if it was that it would have
the
spread
point
more.
I'm trying to make is
Okay.
that the level of hygiene and public health
Generally.
awareness
Is low.
generally is low.
Yes.
All right,
To the
finish up with
point
that.
where people don't understand that
Right.
even
Okay.
germs, bacteria, and things
Can be
can be
passed.
passed through
Okay,
those kind
okay,
of practices.
okay,
All
So
right.
I'm just saying this is the benchmark
Yes.
from which we need to
No, I
start.
just want, so that people don't think you get it through air
Right.
or through water.
Of course
Right.
not.
Yes.
Of
All right,
course
please,
not.
I need you to finish up on that so that we can head back to the phone. Add to that the prevention and treatable part of it. This is the exciting news for me that sometime soon we might be able to prevent and treat Ebola.
Well, the vaccines are still are still under trials and
Right.
have not been confirmed. But in those places like the Democratic Republic of Congo, they are still going on trials, which means people are taking it and they are watching it, but it has not been confirmed.
No conclusion yet.
No conclusion.
No, they
Well,
say it's 90% success.
we have-
rate
we
for
have
those
but
Dr.
there has to be a
Trials.
mention.
Yes.
Wait,
they have to go
gentlemen,
for
gentlemen, we need to go to the phone line now. Dr. Jide Idris joins us, right? Dr. Jide Idris, good morning to you.
Good morning, sir.
Thank you for holding the line. We really appreciate it. Dr. Jide Idris, by the way, is former health commissioner here in Lagos. Let me ask you this. You were responsible for healthcare planning, health policy formulation, implementation, as well as supervising health service delivery in Lagos during your tenure. What area of Lagos State health services needs improvement?
Well, to be frank with you, virtually all the areas need improvement. We also know that you cannot achieve this because of the funding for the health sector. Yes, the government is trying, but the fact is that what is required is enormous. And that's why I believe that health is everybody's business. Of course, government has its own responsibility. One, I know that if you look at the national health accounts or state health accounts, only 2 states are doing that now. A huge chunk of the funding goes into curative care, very little for preventive care. So, just in line with what I heard the other people say, yes, we need to do more prevention. It's because of, they say prevention is better than cure.
Right.
One.
Right.
Two, it's part of prevention again that building public health infrastructure also builds for prevention. One of the major ones is, like somebody said, is health education, public enlightenment. That is huge. But to do this too also costs money because before you pass messages through the local media, etc., you have to drop the messages, prevent messages to the population. It costs money. So, by and large, yes, a major aspect of that, public enlightenment, public development. And that's one of the major contributors to our success in 2014. So I agree with you. But more importantly, the government should be prepared for emergencies like this.
Right.
Somebody referred to what happened in Guinea. What really happened in Guinea was a problem of environment and the fact that most of these diseases were diseases of animals. We broke down the environment, they increased the contact between animals, infected animals, and the people. That's how this thing got
in
to
the rural
people.
areas, especially.
Are you with me?
Yes.
Right.
And because they do not have the knowledge of the virus, how it moves, how it presents, people started doing things without necessary proper behavior, and that's why things spread.
Right.
And again, culture has a lot to play there.
Yeah.
Because when people die, they have these rituals and all. People do all sorts of ceremonies. In the process,
We have
this
it
thing
here
is
too.
spread.
You worship dead body.
So, public enlightenment is key. We also need to build up our infrastructure. Somebody mentioned human resources. Yes, that's correct. In fact, the situation is even worse now than it used to be. But by and large, with what we have as a country, we could still do better if we fully concentrate fully on some aspects of our health sector.
What was it like handling the first case we had in Lagos? The activations that were made then by the Lagos State government and the federal government. What was it like then? Could you take us through that? What were the things that were done?
Let me say that, I know a government has to be proactive and must have vision. We were lucky in the sense that at that time, we started out as a government and decided, okay, what are we vulnerable to as a state? We mapped them out and we started planning for disaster management. But again, we concentrate more on physical disaster. We never looked about biological disaster. But again, in ministry, we just said, suppose we had something like that, what we would do. So we started putting something in place. Yes. So when this thing came up, it was like rallying around whatever we had and see how best to control it. And at the point in time, it's okay. If we don't know anything, go back to this one. Go back to basics. Infection prevention control, basically. And that's how we started. Until we started unraveling the nature of the virus, etc. and again. So I think it was a combination of the vision of the state government then, collaboration between all stakeholders, both federal government, the volunteers, even the people themselves, and the external agencies who gave support on knowledge, etc., and their personnel.
Right.
So all of us worked together to address a common cause.
Right. Before we head to the phone to take the calls, Ms. Chinyere, let's run through Ebola again. Let's just do this awareness. So what is Ebola? Yeah. What do you look out for? What are the symptoms? How does it present? What's the incubation period? What should we watch out for? When should you go to the hospital?
Ebola is...
Okay. That's for Mrs. Chinyere. Yes, 1 minute.
Okay, sorry. I'm sorry.
All right, sir.
I already said, Ebola is a deadly viral disease that presents as hemorrhagic fever. It has some symptoms like high fever, headaches, sore throat, passing of blood, as if their nose, blood coming out through the nose. So when people go to the hospital and they have all these symptoms, they are directed to the intensive care unit where their samples are being taken. But precautions has to be taken even for the health workers who are taking care of them or those who are bringing them to the hospitals, because most times when they come like that, even the people that brought them are also tested.
They're exposed.
They are also exposed. So when they come to the hospital and all these symptoms are noticed, they are really direct and their samples are being sent to the research labs where they are confirmed or they are said nothing. Then most of the things that we have to look out for are like that Nigerian, like the airways, when people come into the country. I think that health facility in the airports,
body scans,
all those, they have to be implemented so that people don't come into the countries with it, and people are checked not to go to those areas where they are still being treated. And we have to know that Ebola, the main look at it is not airborne, it's not waterborne, but it's animal-borne. Most people who get infected, especially, I know we've not mentioned all these people that work in the zoo, all these pets, veterinary doctors. I think that aspect, not just human, since it comes through the animal, since it's animal-borne, zoonotic,
butchers.
I think that's the point I want to make.
Butchers with low literacy.
We need to focus on those areas.
That's the public awareness, so that we know that it comes through is animal-borne.
But how do they identify that an animal's got Ebola? Will they know? Is it something they can...
If it's a vector, you probably will not know because it's a carrier.
Well, in Nigeria now, that as it has been stated, there is no Ebola. So we have been...
We need public education to the level where butchers, as a matter of routine,
people that have pets,
do not cut meat with their bare hands making contact with blood. All those preventive things need to be done now. That's my point. We need to... It's all the public education and awareness that you do before.
Right.
Yeah.
Right.
That helps.
That helps, not after. Look, we were really lucky. Dr. Jide and his colleagues worked miracles. They worked miracles with little resources, but we were lucky that the thing was contained in an urban urban centers.
All right, sir. Go ahead.
Yes, please.
Well, I want to agree with you, and that's why the current trend now is what they call One Health agenda. In the sense that you look at health now, not only from the point of Ministry of Health, you have to work hand in hand with people in the environment. You have to work hand in hand with people in agriculture. The essence is that most of these are diseases of animals that come in contact with human beings. Now, the environment again has a role to play in the transmission of these diseases. So if all those ministries of people working those can work together, sit down and design programs for prevention, design programs for detection. Are you with me? Then we'll be better off.
Right.
So for instance, somebody asked the question, how do you know an animal has disease?
Yeah.
This is the responsibility of the Ministry of Environment of Veterinary Medicine. But we can all work together because the same laboratory people do the same work in the same lab. They have the experience, so it's like,
And one of those animals that dog insists on being a part of this program, and it would not be shut up.
it will be rabies.
Yeah, so this is a point where we head to the phones. The dog has also joined that conversation to say animals.
You don't just accuse us anyhow.
We are here and we're going to speak for ourselves. Here are the phone numbers, people. You can join us now.
Call us on 01-277-0993, 01-277-1993, 01-277-2993, and 01-277-3993. This is Nigeria Info. We are listening.
This is Nigeria Info. We are listening and we're looking at Ebola management in Nigeria. I mean, we were lucky to escape the last time. Once we saw the red flag from NCA, we said, oh, what? We need to watch out again and ask ourselves, are we ready? So we're looking at outbound passengers at the airport. Are we looking at the animals, the veterinary doctors, those who have, butchers, like Rotimi has said, people who deal with animals every day. At the rural areas, people still eat these animals.
Bush meat
is favorite for some people. And we have on the line Dr. Jide Idris, former Commissioner of Health in Lagos. We also have Mr. Sam Adewuni, who is currently the PRO, the DG of the NCAA. Rotimi Sankore is here. Mrs. Chinyere Ugo is a senior medical laboratory scientist here in Lagos. Let's head to the phone, shall we?
We have Benson joining us right now. Benson, good morning to you. Hello, Benson.
Benson, are you there? Okay, maybe not.
That line 5 is having a bit of issues. Let's leave that line. You can also send us your thoughts on WhatsApp. We'll be taking your WhatsApp messages. The WhatsApp line is 0809 597 5805. That is 0809 597 5805. I have this message from a Siri. Siri says, but we know that the yellow cards are sold. People buy them without actually taking vaccine. This goes to Mr. Sam. Mr. Sam, there you go.
Hello.
Yes. So one of our listeners just said, while we're even watching out for yellow fever, you present your yellow fever card. Many of those cards are bots. I mean, this is really alarming. So we're not really sure what's going on based on the paper people present. So can we have those body scanners at the airports?
Is it a possibility?
It is a possibility. I'm even aware that order has been placed for those scanners. I read it on the news media recently.
Okay.
The contracts have been awarded. But we all know that all of this intake follow a due process.
Right.
And that due process could take years.
It takes time.
Yeah.
Well, it has become an issue that everybody has been talking about it. I heard the former works minister complaining to the National Assembly that there's a need to review that law.
Right.
Because when you talk about due process, it takes a minimum of 9 months to get through, and it's also a product of law, so they have to review the law.
Wow. Let's speak with Yemi.
Yeah.
Yemi's on the line from Ikeja. Good morning.
Yeah, Wemimo, good morning.
Good morning.
Thank you so much for this program you guys have brought on board this morning. I'm a first-time caller, but an ardent follower of your program.
Good to have you calling.
Please, there was a question you raised with the NCAA guy. You asked that question that what effort is being taken about, outbound passengers. That, if it is not addressed, is a huge lacuna. You mentioned the fact that we have land borders that are non-manned. People coming from all different countries into our country, and then they are going out of the country and nothing is done about it. That is a big challenge. And I want to invite NCAA to please look at that area very, very well. Or else we run the risk. Thank you very much.
Thank you so much for calling us.
Thank you, Yemi. Let me take this message from WhatsApp. And Bioye from Yaba says, one of the biggest reasons we were lucky with Ebola was because the hospitals were closed then. We need to jumpstart preventive measures.
It means the general hospital, public hospitals.
Yeah.
The public hospitals.
That if those people had ended
gone.
up in the public hospital with the poor facilities,
right. Christian
from down the queue with their buttocks.
Christian from Lawan Singh says, I want to commend your radio station for a wonderful program like
Did
this.
you hear what Rotimi said?
I did.
Rotimi said that again.
All right. Christian says, since after our the breakout of Ebola last time, its containment, little is being said about the health workers who actually paid the ultimate price.
And this brings us to asking Sister health workers pretty at risk. I mean, you go to the hospitals, you guys still check temperature with your hands. I mean, you still see a little baby and you're like, is she really hot? No, go pour in water. For health workers, how safe are you?
Well, for health workers, we are advised to use our personal protective clothing.
Personal.
Why personal?
No, you should have your lab coat, their gloves, their face masks, and then your shoes and all of that. So,
and these are all available, provided for you?
They are available to an extent. You know, there is this human factor.
What is this human factor?
Positive spin on things.
Yeah, she
instead of saying it as it is.
see why.
More money is required to make sure that every health worker has multiple pieces of all those items.
All right, we have someone on the line. Please hold on.
CY, good morning to you.
Hello, CY.
On that line.
Okay, we can't hear you. So, Mrs. Shiera, do you have protective gears? This is the point where you tell us what really you don't have.
We have it, but we still need more. Resources are needed for health workers because most of the time they are limited. They just bring it and it's shared, and maybe at some time there's limit to the.
I'm trying to get to your messages on Facebook. Please do bear with us. I can see messages here, but I'm quite unable to read them. I hope I can before we go. Okay. Editable Judge says there are more than one centers for testing Ebola virus in Nigeria. We are most unfair to the nurse who also worked in the First Foundation. You mean First Consultant, where Dr. Adewuni also worked. Both died, but no mention of the nurse's efforts. The use of a handheld thermometer is recommended by WHO and is sufficient. Blood circulates all over the body and temperature is the same. Comfort Luke says, I was almost trapped into this one. Let's see if we can get some more in.
But holding up those things for hours on end at the airport
throughout the day
is a problem.
Would not work effectively with what we have.
You can do it once or twice, but not for a plane dropping 300 passengers times 10.
All right. We must go now. Let's keep talking about Ebola and make sure that your hygiene is top notch. Wash your hands as often as you can. Stay away from as much as you can from other people's sweats. That one especially gets me irritated.
Don't wash dead body. Don't hold dead body.
Prevention, they say, is always better.
Start now. Start today. Now. Don't wait till you hear that Ebola is in Nigeria before you start, raising your hygiene level.
That's right. Let's thank Mr. Chikwe Ihekwe, who joined us earlier. He's the Director General, Nigeria Center for Disease Control. Also, Mr. Sam Adurugboye, General Manager and PRO of Nigeria Civil Aviation Authority. Thank you for joining us, Mr. Sam.
Thank you. Thank you very much.
Dr. Jide Idris is the immediate past Commissioner for Health in Lagos. Thank you for your time, sir.
My pleasure.
Have a good day. Mrs. Chinyere Ugo, Senior Medical Laboratory Scientist here in Lagos. Thank you so much for coming in the studio. And Rotimi, throwing in the span and the works. Thank you very much for being here as always.
We have to raise the bar. We have to raise the bar.
Okay, that's his thank you. So we'll see you all tomorrow. We have been produced by Zainab Yakin. Big thanks to Yvonne Ohaifo and Tosin Akinrede for assisting, as well as Babatunde also for being behind the cameras. That's why you can see us. We'll see you tomorrow morning on the show with more conversations. There'll be swearing in for the permanent secretaries in Lagos today.
Right.
Tomorrow there will be swearing in for commissioners.
Right.
So
and advisors.
So we'll be here giving you the coverage on Nigeria Info tomorrow morning. We'll see you again then.
Who got which appointment?
Right. We really can't wait to know how that plays out. I'm Wemimo Adewuni.
And I'm Sheriff Quadry.
We'll see you tomorrow.